motion, elbow extension. Have your partner lie supine on the mat table with their arm at their side and the forearm in neutral. Place a face cradle or roll towel under the elbow to elevate the arm. Have your partner keep their elbow extended to measure range of motion. The axis of rotation is the lateral epicondyle of the humerus, the stationary arm is the lateral midline of the humerus, and the mobile arm is the radial styloid process. Normal range of motion is 0 degrees. Here, Miriam is demonstrating negative 15 degrees of hyperextension. Elbow manual muscle test, biceps brachii. Stand on the side of the arm being tested. Assess your partner's full range of motion into flexion. Have your partner sit with their elbow flexed to 90 degrees and forearm supinated. Stabilize your partner's trunk with one arm and place the resisting hand at the distal radius and ulna, just proximal to the wrist joint. Resist in a downward direction. The long head of the biceps brachii originates at the supraglenoid tubercle of the scapula, and the short head originates at the coracoid process. Both heads insert into the radial tuberosity, performing actions of elbow flexion and shoulder flexion in the sagittal plane and supination in the transverse plane. Miriam would receive a grade 5 for completing the full range of motion against resistance from the examiner. Spine range of motion, cervical rotation. Have your partner sit with their head in a neutral position. Place the axis of rotation over the center of the skull. The stationary arm is parallel to the acromion, and the mobile arm is aligned with the tip of the nose. Normal range of motion of cervical rotation is 80 degrees. Here, Miriam is demonstrating 83 degrees of cervical rotation. Shoulder manual muscle test, lower trapezius. Have your partner lie prone with their arm placed in 145 degrees of abduction and the thumb pointing to the ceiling. Stand at the side of the arm being tested and assess available range of motion. Place one hand below the spine of the scapula of the testing arm and place your other hand just proximal to the elbow joint on the humerus. Instruct your partner to raise their arm up to the ceiling. Resist in a downward direction. The lower trapezius originates on the spinous processes of the T5 through T12 vertebrae and inserts on the lateral end of the clavicle, acromion, and spine of the scapula. The lower fibers of the trapezius perform actions such as scapular upward rotation in the transverse plane, retraction in the sagittal plane, and depression in the frontal plane. Miriam would receive a grade 5 for holding the position against resistance. Knee range of motion, knee flexion. Have your partner lie supine on the mat table, flexing their hip to 90 degrees and flexing their knee to maximum knee flexion. The axis of rotation is placed over the lateral epicondyle of the femur. The stationary arm is aligned on the thigh to the greater trochanter, and the mobile arm is aligned with the lateral malleolus. Normal knee flexion range of motion is 140 degrees. Here, Miriam is demonstrating 125 degrees of knee flexion. Knee manual muscle test, quadriceps. Have your partner sitting on the mat table with their feet dangling. Place one hand underneath the distal thigh to support the leg. Have your partner extend their knee straight, then bend slightly 15 to 20 degrees. Place your other hand just proximal to the ankle and apply a downward force. Miriam would receive a grade 5 for holding the position against resistance. The quadriceps muscle group consists of the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The rectus femoris originates at the anterior inferior iliac spine, inserts on the tibial tuberosity, and performs hip flexion and knee extension in the sagittal plane. The vastus lateralis originates at the superior lateral femur, inserts on the lateral border of the patella and tibial tuberosity, and performs knee extension. The vastus medialis originates at the medial and posterior femur, inserts on the medial border of the patella and tibial tuberosity, and performs knee extension. The vastus intermedius originates at the anterior femur, inserts on the superior border of the patella and tibial tuberosity, and also performs knee extension.